Hi, my name is Tiffany All. I am wearing my Nightingale badge and my scrubs, and I'm going to perform a venipuncture. So I would go ahead and start by performing hand hygiene. I would put on clean gloves, introduce myself to my patient. My name is Tiffany. I'm going to be your nurse today. I would verify their first and last name and date of birth against their wristband. I would go ahead and explain the procedure and make sure they don't have any questions and that they understand what we'll be doing. I would go ahead and find a good vein to use. Once I did, I would apply a tourniquet 4 to 6 inches above where I plan to do my venipuncture site. That tourniquet on there, make sure it's not too tight. I would check for a distal pulse, which is there, so that's good. And then I would grab my alcohol pad and I would clean the area. You want to start from the middle and go ahead and work your way out in a circular motion. You want to make sure that you clean it for about 30 seconds. Okay, discard of that. And then because my patient is a 30-year-old woman who is just getting IV fluids to replenish what she has lost from dehydration, I'm going to use a 22 gauge syringe with a 1-inch catheter. And I have my extension tubing and saline that I have prepped. And we'll go ahead and see it's prepped. There are no air bubbles. Okay, that looks good. I have my tape, I have my transparent dressing, I have my 2x2 gauze, and now my site is dry. So I'd go ahead and get that syringe, remove the cap. Okay, I would want to stabilize the vein, and I want to come and bevel up at about 10 degrees. I would perform my venipuncture, and once I see that there is blood return, I would go ahead and advance another 1/4 of an inch. And then I'm going to want to loosen the actual syringe and push the hub of the catheter all the way forward. And then I want to use my finger to go ahead and apply pressure on the vein. And then I would remove the syringe. I would do the safety lock and I would put it into my sharps container. Then I would remove the tourniquet and quickly grab my syringe, my saline syringe, and the extension tubing. I would be sure not to touch the ports of the hub and the tubing. Stabilize that and connect it. And then once that's connected, I would hold it for stabilization. I would aspirate for blood return, and when I see it, I would go ahead and slowly and steadily inject the saline solution. And it's going in smoothly, there's no occlusions. Okay, and once that's done, I would clamp my line and disconnect the syringe and discard it. I would have my transparent dressing here. Okay, and while holding this stable, I want to place the transparent dressing over the blue catheter hub, making sure that's secure. Okay, and then I'm going to remove that, I'm going to get my extension tubing, loop it around, and I'm also going to secure that with some tape. There it is. Okay, that one's out of tape. Good thing I brought it back up. Okay. Okay, I'm going to secure that tubing with some tape. Alright, and then I would also get another piece, and I would just want to secure the top up here too, so it doesn't wiggle around. Okay, and I'd get a Sharpie, and I would write the date and time that I did the venipuncture, that I used a 22 gauge 1-inch needle and catheter, and my initials. And I would collect all of my trash and discard it. Then I would remove my gloves, perform hand hygiene, and I would document. Then when it's time to remove it, I would perform hand hygiene. I would put on a pair of clean gloves. I would again introduce myself to the patient, and I would verify them using first and last name and date of birth against their wristband. And I would explain to them, I'm here to remove your IV because the doctor put in an order to have it removed. And I would start by removing the transparent dressing. So I want to work my way around the edge of it to get that loose. That helps if you tuck it under while you do it. Okay, and then before I take it off of the catheter hub, I want to go ahead and stabilize it. Protect the integrity of the catheter. And then I will also remove the connecting tubing tape. Okay, I would get a 2x2 gauze, fold it in half, and I would slowly and steadily pull out the catheter, making sure that the hub stays parallel to the skin. And then I would apply pressure for 30 seconds while I inspect the catheter. Make sure that it's of good integrity, it's 1 inch, and everything looks good. So I would discard that in my sharps container. And after 30 seconds, I would go ahead and make sure that the bleeding had stopped, and if it did, I would get a new gauze, and then I would go ahead and tape that. Collect all my stuff, throw it away. I would remove my gloves, perform hand hygiene, and I would document.